Thank you very much, Professor Wiegmann, but it's a pleasure to be here to provide some insights on the Czech Republic and developments here in the context of FH screening and particularly FH pediatric screening. We have three screening strategies to diagnose FH. These are opportunistic and cascade testing, selective screening, and newly the pilot project of the universal screening in newborns. Opportunistic testing detects FH patients by routine healthcare procedures done from any reason. Patients with suspicion of FH are then referred to our specialized MedPed centers, and those fulfilling FH diagnostic criteria are put into the database, and cascade testing in families follows. At this moment, I should mention what the MedPed project is. It's an acronym for Make Early Diagnosis to Prevent Early Death in Medical Pedigrees. Our country joined the project in 1997, and it has been running under the umbrella of the Czech Atherosclerosis Society. The main goal is to identify FH patients as early as possible, to start treatment as early as possible, to prevent premature death and non-fatal heart attacks in these high-risk individuals. A key point for MedPed success is a network of collaborating centers which are spread over the whole country. We have 68 sites, 2 national centers, a number of regional centers, and specialized clinics. Where possible, we have established a pediatric center paired with the adult one. We have 18 pediatric centers altogether. Since 1997, the number of FH patients evidenced in the nationwide database has been gradually increasing, and we have detected almost 8,900 FH patients so far. Considering the prevalence 1 to 250, the expected number of FH patients in the Czech Republic is almost 43,000. It means that we have identified 21% of all FH individuals expected to be in Czech Republic, including 647 children. Although the Czech Republic belongs to the most successful countries globally in terms of the relative number of diagnosed FH cases, still there are more than 30,000 FH individuals who have not been diagnosed and treated. Another screening strategy is a selective screening. There is a mandatory cholesterol testing in children aged 5 and 13 in case of premature cardiovascular event in their familial history. This is done by primary care pediatricians as a part of preventive examinations. I should say that the selective screening is a part of reimbursed care. However, the data on how this program is effective is lacking. Now I would like to introduce our pilot project of the universal screening from umbilical blood, which we call Czech-IN, an acronym for Czech cholesterol in newborns, which includes also a pun referring to the Czech environment. The project, with the support from the European Union, has already been initiated. We plan to measure bad LDL cholesterol in 10,000 neonates and perform molecular genetic testing in those with LDL cholesterol above the level of 85th percentile. We are aware of the fact that LDL cholesterol examination for diagnosing FH is the most sensitive and specific when done between 1 and 9 years of age. However, it showed a reasonable sensitivity and specificity also in umbilical blood. And what is a big advantage of this approach? Umbilical blood is more easily available sample than any other blood sample later in life. Aims of the project are to determine umbilical blood LDL cholesterol sensitivity and specificity for diagnosing FH, to find the most effective combination of biochemical and molecular testing for diagnosing FH in neonates, to find out if neonatal testing is a feasible approach for universal screening at the population level. We expect to find 400 newborns with FH, and by reverse cascade testing in their families, we expect to find additional at least 400 FH individuals in this project. And the main goal, of course, is to make check-in of all newborns with FH already at birth, and thus to ensure all children with FH a cardiovascular event-free flight through their lives this way. Thank you very much for your attention. It gives me great pleasure to give the floor to Professor Noël Peretti from France to share with you some of the challenges and opportunities in FH pediatric screening in France. Professor Peretti, Noël, the floor is yours.